Good morning. So today we have a 14-year-old female, very healthy, who was born with three raised yellow tan areas on her left cheek. One, two, three. So presented to me last year, and I was suspicious for Nevus sebaceous. I did the shave excision biopsy, and it came back as Nevus sebaceous. Problem was whether to just excise completely or not, because there were three and it becomes a big long scar. So we went back and forth whether we should observe or we should remove it. The reality is there's not enough data to tell one way or the other. And data is fine, but every individual is different. I have personally seen one case of Nevus sebaceous becoming a sebaceous cell carcinoma in a middle-aged man. So definitely does happen. So I gave the parents all the pros and cons, of both approaches. And after thinking, they decided they want to get it removed. And teenage years is when it can become turn into malignancy sometimes. So this is perfect time for her. Now, to maximize the aesthetic outcome, I have to make sure that I think of the relaxed skin tension lines, RSTL, and they run in the face, like I'm smiling to show you, is this way. See the crow's feet? Just like the crow's feet, they turn the cheek this way. So I'm going to make the patient smile and then mark it. And although it's going to be a long scar, but with time it's going to start blending, and it'll be fantastic. And I'm going to evert the edges, very important, so that initially for the first 3 months almost looks like a speed bump, like a raised area, and then slowly start settling down. It'll be perfect. And if there's ever an issue, we can always laser it down the road as well. So let's show you and let's get started. Great. Nevus sebaceous of the left cheek in a 14-year-old girl. Let's have a smile. Perfect. So first I did the dots just to make sure that I got the margins, makes it easier to do the whole thing. And then I brought it together, giving maybe like a 1 to 2 millimeter margin. You can't take too much, but that should be enough. And it's going to fall into the nice RSTLs, relaxed skin tension line. Long stitch 12 o'clock, short stitch 9 o'clock.
Sure.
Yeah. Thank you. That's great. Okay, there we are. Done. Good. You can stop. No, show all the way down, both of them. This one. No, again. One more time. That's okay. Now, no, now go for it. That's okay. You get it. It's time. Good. Thank you. Okay, so just when you saw what I was doing, to summarize everything, I was able to make sure I'm around by at least 1 to 2 millimeters, and then I did undermining about subcutaneous, about a centimeter at least. Honestly, it was more than a centimeter. I think it's like 1.5 to 2 centimeters on each side, just to make sure there's no tension on the skin closure. Then I used 5-0-PDS to get the deep tissues together and take away all the stress. And then I went to the deep dermis as well to make sure it's closed as well. Then I did vertical mattress sutures. They give the best eversion, hands down. And now my plan is, but they're tight, so they can leave suture marks. So my plan is that I will take those out within 48 hours, 2 days. Just 2 days I'll take it out. And then I'll apply the Derma Bond to give it the extra protection that it needs for a little while. That'll give the best result, and down the road, if you want the laser or something, that can be done, but I think this will end up very good. Oh, and also, we'll get the biopsy report because I did the marking with the sutures as well. So excellent, we'll keep you posted.